regardless of what procedure you get, I always tell my patients the recovery is still 6 weeks. There's still 6 weeks of me having restrictions for you, limiting the things that you can and can't do so that you can heal the best. But the biggest difference with a tummy tuck is that first week is going to be a little tough. Hi guys, welcome to Lipstick and Lipo. I'm Dr. Smita, one of your co-hosts. I'm a board certified plastic surgeon in New Jersey, and I've got my other co-host with me up in Rochester, Dr. Ashley Amalfi. Hi girl, how are you?
Good. Hi, Smita. Welcome everyone to our Google series.
So we are continuing our series about all of the questions you guys have and you Google regularly. And so we're just going to answer them. So this is a great series to tune into, subscribe, because you're getting answers directly from board certified plastic surgeons. So this episode is about tummy tuck. So what exactly is involved in a tummy tuck? And the second part of that is what the recovery process is, which I think is the scariest part for most patients, is just the recovery. So we're going to dive deep into this question because it's a common one that comes up every single day in our practices, and certainly you guys are asking about it. So, Ashley, what are all the things involved in a tummy tuck?
Yes. Let's start with what is it? A tummy tuck is a skin removal surgery. So a tummy tuck is going to get rid of all the skin on your lower belly. So kind of from your belly button to your pubic area, a huge ellipse of skin is going to come out. And then when we remove that skin, we're going to pull your upper belly skin way down tight like a drape. And like if you put your hands on your belly and you pull it down really, really tight, that's what a tummy tuck looks like. It's going to get rid of skin, tighten your belly. On the inside, we're going to tighten your muscles, your ab muscles, and bring those back together because they get separated over time with weight gain or pregnancies. And that's kind of like a corset. So we have like a corset on the inside, making your waist nice and small. And then we pull all the skin down and get rid of the loose extra skin. And sometimes do a little bit of liposuction to contour your hips and your waist and stuff. And we're going to give you a gorgeous waistline and a tight, flat tummy, which who wouldn't want that, right?
I know. I literally love these procedures because it really does give you that just, and especially if you're a female, right? Obviously, we wouldn't give a male an hourglass figure, but for a female, it just really gives you that beautiful silhouette and can really give you those like beautiful hips, a nice waistline. And we're really addressing all of the changes that occur with weight gain, weight loss, pregnancies. You know, we're repositioning the muscle, removing the extra skin, and then sort of fine tuning and removing any excess fat. So one of my favorite procedures.
It's dramatic. Like some of the things we've been talking about are like subtle changes. This is like drama. This is like, whoa, girl, you look incredible. And so that's why it's like worth the recovery part, right? Which is like the second piece of this. That's what everyone wants to know. Like, okay, yeah, it sounds great, but I have a busy life, and how am I going to make this work? So how do you answer that for your patients, Smita?
Yeah. Well, so, the recovery can be scary, but at the end of the day, just regardless of what procedure you get, I always tell my patients the recovery is still 6 weeks. There's still 6 weeks of me having restrictions for you, limiting the things that you can and can't do so that you can heal the best. But the biggest difference with a tummy tuck is that first week is going to be a little tough, right? You're just, and it's not necessarily pain, right? I think we do everything we can in the operating room to sort of give you nerve blocks and do all of this stuff so that you have a smooth recovery the first couple of days. But it's just, it's a lot going on, right? Most people are constipated. They have to sleep on their back in this weird position. And if you're not a back sleeper, you're not sleeping. So you're not sleeping, you're constipated, and you just can't move around as freely as you want. So it just makes it miserable. Yeah. Not necessarily painful, but just miserable.
Everything is hard. Like because when your belly is sore and we operate on your belly, it's hard to get up out of a chair, out of bed, to move around. So you just need a lot of help. And for especially our female patients, that's hard to not be the one taking care of everyone else. So the first week is hard, but by a month, you're going to feel really good. And, a month and a half, 2 months, you're going to be back doing everything you did. So it's really just a handful of weeks out of like getting out of your normal routine. And if you can work from
Yeah.
home, it's not that bad. So
No, it's
it's
not.
becoming much more attainable for patients, but don't be scared of recovery. It's very doable. No one goes through tummy tuck recovery and is like, that was awful. I should never do it again. It's like childbirth.
Yeah,
You
no,
like
it's
forget. I
yeah, I
lost
was
an
gonna
earbud.
say,
You
yeah, it's
forget,
it's the opposite. You
and
forget
it's
how
worth it.
bad it was, and you're like,
Yes.
I should have done this earlier. I like don't know why I was so nervous. I mean, literally, I think that's 100% of my patients. So, just a couple of weeks, you just have to get through it. But then once you do, it's a lifelong change, and it makes such a difference in literally everything: your confidence, your clothing, just how you carry yourself, and how you feel about yourself. And so, it's well worth it.
Well worth it. Every day you'll get results for the rest of your life. So don't be scared. Find a board certified plastic surgeon. A tummy tuck is a great procedure, and you're going to be really, really happy. And we can't wait to see you. So come find us for a consult. Check out Lipstick and Lipo. We have all your answers to your commonly Googled questions about plastic surgery. So we can't wait to answer the next question. We'll see you guys next week.
See you guys next week. Bye. Bye, Ash.